Hi everyone, this is Dr. Praveen Patil here. I welcome to my channel SkillAyurveda. So today I am going to present a case of cauliflower ear or hematoma of the ear or hematoma of the auris. This is a normal ear what you are seeing now. So any kind of blunt injury that is commonly seen in case of the contact sports injuries. So what happens? So we may get a bleed in between the perichondrium and cartilage that leads into death of the cartilage within 5 to 7 days. So early detection is very much important in these cases, and we have to go for early drainage also. So or else we may land up with the infection or deformity of the cartilage, so that is disfigurement of the external ear. This is commonly seen in the wrestlers, boxers and martial arts people. The commonly affected ear is the left ear, because the most of the hit what they get by the while in the wrestling and boxing, so that is from the right hand of the opposite person. So that's why left ear is most commonly affected. And I am going to show another case of the Hematoma Auris. So here you can see a small hematoma is there. So what I did here in this case, so after draining on the dependent part, so what I did, I used a shirt sterile button to fix the anterior as well as the posterior surface of the ear. So this will prevent the recurrence or reaccumulation of the seroma in that layer. So after 48 hours, so we'll get this kind of impression. Here two buttons are fixed on the either side of the ear pinna, and care should be taken that you should not give a maximum pressure on the skin and turn the skin into necrosed. So what happens if you just drain the hematoma auris, then the patient has to come for the follow-up or regular dressing for longer duration, because repeated seromal accumulation will be there. To overcome this problem, so appropriate size button we have to choose and we have to fix it, so for 48 hours. So after that, so as per my observation, there is no any reaccumulation of the seroma. So this is what I wanted to show about the cauliflower ear or hematoma of the ear or hematoma auris. Thank you. Thanks for watching my video.